The doctor pulled it out and she said, "We got most of it," and an arm was missing.
Earlier this year, Ashley Gilbert joined an unexpected sorority, becoming one of thousands of women dealing with a startling complication from a popular birth control device. After nearly a decade of having the Paragard IUD implanted in her uterus, it broke upon removal.
Shock, disbelief. I didn't know that could happen until right before the visit.
Unaware of a problem first exposed by a Spotlight on America investigation this spring. Using an FDA database that tracks adverse events, our team discovered more than 3,200 women have reported Paragard breakage, an arm from the T-shaped device snapping off, sometimes staying inside their bodies.
At any point when you saw your doctor in the last 10 years, did they tell you, "Oh, by the way, this is now a complication you should know about"?
They did not, and if they had, I would have had it removed earlier.
But we discovered Ashley and other women should have been informed about the possibility of breakage because we've learned the company knew of the increasing problem and made a significant change you'll only find in the fine print. Spotlight on America learned that the maker of Paragard began reporting complaints it received about breakage to the FDA in 2013, with the total hitting nearly 2,500 in 2019. That's when the company changed its label, finally including breakage under warnings and precautions. But they did not notify women who already had the long-lasting device inside their bodies.
It's a perfectly reasonable expectation for a company to inform their users.
Dr. Brian Nguyen handles 1 to 2 breakage cases a week, referred from county clinics in Los Angeles where he works. While the OBGYN and assistant professor at the University of Southern California maintains Paragard is very safe and breakage a very rare complication, he's launching a research study to figure out what's causing it.
One of the difficulties here with the IUD is that it's a long-acting method, and we need to have a lot of data to really understand what's going on. And not only that, it can be multifactorial, and we don't have these answers yet.
They're answers women are seeking, turning to social media groups and sites like IUD Alert, where we saw stories of breakage from across the country.
They're more than just a number, and it's affected their lives pretty significantly, and in a way that they were never informed was possible.
Grace Emily Stark, part of the IUD Alert team, who also once worked at the FDA, believes women should be informed about the risk of breakage or any complication.
It would ultimately be up to the FDA at the end of the day, as the regulators of drugs and medical devices, how aggressive they wanted to be with hounding a pharmaceutical company into doing the responsible thing.
Spotlight on America reached out to Paragard multiple times asking specific questions. They told us simply they're deeply committed to providing safe, high-quality products in compliance with all state and federal regulatory entities. The FDA tells us the label for Paragard contains all necessary information for safe and effective use, and it's not currently requesting further studies of the device. The agency says when it approves the label change, the update is made publicly available and must be distributed with the product, although companies can generally choose how they communicate those changes to patients. For former users like Ashley Gilbert, it's not enough.
What do you think about the fact that it's not the company doing the outreach, it's women talking to women?
I think it's great that women can support one another through this, but that should not be on us.
I'm Josie Sturman for Spotlight on America.